So we need to be more authentic with each other.
Whole life, physically, mentally, and spiritually.
Christ, Jesus, the great physician. And he was healed, and now
It's really time to reconnect with your family.
All about life, health, and healing hope.
welcome to this edition of Healing Hope. On today's show, filmmaker Martin Doblmeier sits down with Lonnie to discuss his documentary, The Adventists, which explores Adventist healthcare in America and the overall impact of the Adventist health mission. And later on, we'll learn about the warning signs of cancer. But first, here's Lonnie Melashenko and Dr. Becky Wong.
Welcome to Healing Hope, talking about life, talking about health, together with my co-host, Dr. Rebecca Wong. Thanks for joining me again today. We have a very special guest on our broadcast today.
Yes, we do, Lonnie. Martin Doblmeier is an award-winning documentary filmmaker, and we were privileged for him to come to Kettering Medical Center a year ago, and I was able to go around and help him get into the operating room and different hospital units to film what we do at Kettering every day at the intersection of faith and healing in the hospital setting.
That's right, and he's an incredible personality himself, very, very gifted, not only behind the camera, producing, and actually his voice is on that film as well. He did his homework. He went all the way back to the beginnings of, health in America when we were kind of down in the pits in terms of how we took care of patients.
And the difference that Adventists made and contributed to the whole health of America back in the mid-1800s.
That's right.
So, Lonnie, I can't wait to hear your interview with Martin.
Thank you so much in your busy schedule for joining us here on Healing Hope. I know you're about to fly out of town and head to some other appointments, but you've been making documentaries for years, starting 15, 20 years ago with
25.
The Heart Has Its Reasons, and then one on Dietrich Bonhoeffer, and another one on forgiveness, which is still a popular one on the internet. Why would you choose, at this stage in your career, to do one on Adventist healthcare?
Well, for me, all the films are on topics of religion, faith, spirituality, so I would have hoped I would have gotten around to it somewhere along the line. I have Adventist friends, but it was because I was invited to go to Loma Linda several years ago and show one of the earlier films on Dietrich Bonhoeffer. And I was at the Loma Linda University Church, and while I was out there, my wife and I had the opportunity to see the medical facilities, the proton accelerator, meet Dr. Len Bailey, and I began to formulate an idea. We could make a documentary film about the intersection between faith and healthcare with Adventists, and to talk about the Adventist story, which I thought was untold.
Well, as you began filming, did anything surprise you?
Well, it was a constant surprise. I think one of the things that I came away with a new appreciation for is how Adventists honor the Sabbath. I think the truth is that for most Christians today, Sunday's become another work day. It's become a day when you go to church, if you go to church on Sunday morning, and then the rest of the day is devoted to taking care of the house or running all the errands. And by Monday morning, you're exhausted going back to work. Adventists take it differently. Saturday is the day of worship and gathering, but it's also a true day of rest. And I think from a health message, that's an important thing. But I think also from a spiritual rest point of view, that's a really valuable message. So I think the gift that the film brings is to show most people in this country who may not be aware of the value that Adventists give to Sabbath. I think that's a really special moment.
Now, you focused on several Adventist healthcare facilities. Was there any kind of a common thread that you found, whether it was in Florida or Loma Linda or here at Kettering?
Well, I think commitment to mission. I think I saw again and again that there was a genuine focus on what the purpose of the healthcare effort was, and that it was centered around the appreciation that hospital work, healthcare work, is sacred work, and that caring for the body is, when you're caring for the body, you're caring for the temple of God.
You follow some very personal stories with patients and their families. The family with a son who desperately needs a heart transplant, for example. That was very, very touching. Was that hard to do?
Certainly it's hard to do, and with these kind of films, you're constantly engaging people in their personal lives at really the most vulnerable moments, I think. And I think from a filmmaking point of view, you have to be really sensitive to the moment in which you've encountered these families and these people. And you come in as a stranger. You hope that there's been some trust that's begun to develop between you and the times that you've met in advance, but really they take an enormous risk to give us the opportunity to tell their story. And this particular story was quite remarkable. We had decided we would film that particular week at Loma Linda, and really weren't sure exactly what was going to happen that week. And the remarkable thing that happened, and I think in some ways the hand of Providence gets involved in this, but a young boy was on the list to get a heart transplant, but there was no heart available. So all they could do was an operation to see if they could keep him alive for several more months in the faint hope that he might be able to find a heart, they might be able to find a heart for him. And the curious thing was that his older brother, 7 years older than him, had gone through the exact same experience with Dr. Leonard Bailey 7 years before that.
Two people in the same family needed a heart transplant.
That mother and father, I just have so much respect for the mother and father. They're people of faith, and sometimes, you have to look at the world that's unfolding in front of us, and you wonder how much can people take, and having these kind of situations confronted. But they're people of deep faith, and they would stay upstairs while the operations were going on and read the Bible, the sacred text, and hope to God that things were going to work out okay. And in both cases, the prognosis looks terrific.
Let's take just a moment and look at a clip from the film.
Today, Adventists operate some of the nation's leading hospitals.
One of the key ways that we thought we would make history is to create the community hospital of the future.
Explore the latest medical technology.
To the trained eye, he has an aneurysm right here.
Expand on the pioneering work of infant heart transplants.
In fact, we can take his heart out, put a new heart in. There's something miraculous about all that.
Practice a body, mind, and spirit approach to health and healing.
Even the curriculum in medical school is changing to incorporate a more holistic view.
And the irony is that Adventists, who believe in the near end of the world, are now among the healthiest and longest living people on the planet.
Well, I'm 98 years young.
They live anywhere from 5 to up to 10 years longer. It's pretty exciting.
Longevity is one focus of the film. As researchers study Adventists, what are they finding about that?
Well, they're saying time and time again that if you want to live a longer and seemingly healthier life, you live like an Adventist. The language is pretty clear. The British Journal of Medicine, one of the 10 criteria for a longer life says live like an Adventist.
Newsweek.
Newsweek, and what does that mean? It simply, it means really, I'm not sure necessarily whether there's that many different components that we don't already know. Vegetarian lifestyle for Adventists, and they don't smoke, they don't drink. They take that day of Sabbath, the day of rest, very seriously. These are things that we commonly know, we should be knowing in our health reasoning. But the truth of the matter is, it's part of the faith tradition of Adventist, of Seventh-day Adventist, and that's where, for us, as a company that's interested in telling stories on the intersection between faith and our daily lives, that to me made a perfect intersection between those two, because you do it not simply to live longer. You do it in the most fundamental reason because you believe that the body is the temple of God and that it needs to be honored and respected. And that's a very different reason, I think, than simply wanting to live longer.
We'll have more with Lonnie Melashenko and Martin Doblmeier after this brief break.